It's not a canal, okay? And so you need to know the name of this, the eustachian tube. When you're on an airplane and you feel like you have pressure in your ears, that's because the pressure outside is different from the pressure in your middle ear. And so what do you instinctively do?
Swallow.
Open your mouth or swallow, which stretches the opening of the tympanic membrane in your posterior pharynx and allows the pressure to equilibrate, which is also why when you have a cold and the tissue is more swollen in the area, that you cannot equilibrate as well, because the normal activities, the tissue is swollen and they don't allow the opening as well. It also explains why little kids are constantly getting middle ear infections, right? There is an opening in the back of your throat and those microorganisms can just climb right up this eustachian tube and get into the middle ear and cause an infection. Adults typically don't have the same problem because as we grow, angles change and it makes it more difficult and much less common for adults to get middle ear infections. That's a very rare thing for adults typically. Okay? Everybody good on the outer and the middle ear? Okay, let's quiz ourselves. What is this? Okay, what is this? External auditory canal. Okay, what is this? Tympanic membrane. Is eardrum acceptable? No, it's anatomy, right? So we got to use fancy anatomy terms. So the tympanic membrane. What is the anatomic name for the hammer?
Malleus.
What is the anatomic name for the anvil?
Incus.
Incus. What is the anatomic name for the stirrup right here?
Stapes.
Stapes, okay? Now, within the petrous portion of the temporal bone, you have the inner ear structures, okay? Now, I'm lifting them out like you can separate them. This is important. This is a solid bone in the inner ear, and essentially the inner ear structures have been hollowed out. So these structures, this is the bone that's really part of this bone, okay? But the bone has been hollowed out into these shapes. And within the bony structures, within the bony labyrinth, are membranous structures filling them. Everybody got that? So these are the hollowed out bony areas, okay? And within them, there are membranous structures, and they have different names and pieces, okay? Now, second concept. So we understand there's bony labyrinth, which is just hollowed out of this hard petrous portion. It doesn't look like this. We cannot lift this out, okay? Because bone is filling all this. And then inside of here there are ducts. Now the other thing about the inner ear is there's really three general anatomic regions. There's this snail-like part, which is called what? The cochlea. And it has to do with what, folks? Hearing. This is where the hearing structures are, okay? There is this portion right here in the bony area called the vestibule, and it has to do with balance and equilibrium, okay? It has to do with more linear kind of equilibrium, okay? Static equilibrium is what it's called. So it has to do with when I'm walking this way, okay? There are structures inside that vestibule that help me with this kind of motion. And then these bony structures back here are called what? Semicircular canals, the bony structures. And they have to do also with, okay, with equilibrium and balance, but it's more dynamic, the kind that, you know, when you do this, right? So when you're 6, you can do this for hours on end, and these little things work fine. And when you're 46, you do this once, and you're like, whoa, okay? It don't work quite as well. All right, so again, what is this part? Cochlea. What is this part? What are these? Okay, so what is the nerve that comes from here called? Vestibulocochlear nerve. So the vestibular part of the nerve has to do with balance. The cochlear part of the nerve refers to the hearing, hence the names, okay? All right, now, I'm going to go from this model